Hey guys, Bob Canada, how are you? I'm going to take about 10 minutes, 15 minutes at the most, maybe. I just want to go over a couple of slides to uh, further clarify what we have here with Capstone Health. Whether you're looking at this as a business owner or someone who maybe can connect us to a business owner, it's good you understand, obviously, the program and what we have here. So let me jump into it. Um, I always get the first slide, never changes. So what is Capstone Health, guys? It's a proactive healthcare monitoring and management benefits program. We offer it to companies, okay, and then they offer it to their employees. Okay, it's that simple. And because it's an automatic enrollment, employees opt out. There's a very high percentage, about 90% of the employee workforce actually dives right in with this. They love it. And you're going to see why, because it makes perfect sense. Okay. So let's talk about for the company. The average about 500 savings per employee per year in FICA tax realized by the employer. Okay. Not to mention, because people are going to be using this program for telehealth and stuff, it's going to lower their probably premiums on their regular health program. Okay. The app to the employee, they get all these benefits, which we're going to talk about, and they're going to see about an average of $80 to $100 a month actually extra in their paycheck, pretty much at no cost. No cost to the employer, no cost to the employees. I'll tell you how the program's funded in a second, because how can it be? Someone's paying for the program. You'll see how that is, but it's at no direct cost to the employees or the employer. Okay, and there's also great referral income if you could simply get this to a business, not bring them on board, upload them, none of that. Just get them on a phone call with Capstone. They take it from there. If they come on board, there's some crazy money. I'll show you that at the end. Okay. So what is Capstone? They're a nationally brokered, nationally licensed, 56-year in business insurance company with over a 40-person team working, over 4,000 agents, brokers nationwide, and they've insured over 250,000 people. Okay, so or they currently have over 250,000 people with them insured. All right. So next slide. The employees, why employees are offering this, as I mentioned, not just the revenue, the FICA tax savings, healthier employees, happier employees, better retention. And again, it'll lower the premium on their regular health plan because they'll be tapping into this wellness plan, and it'll save a lot of doctor's visits. Okay. So let's go into how it works real briefly. Our program works with a Section 125 pre-tax prioritizing preventative health. What does that mean? If you have a preventative health, it prioritizes the tax dollars. What it allows is monthly plan costs come out to lower the employee taxable income. What does that do? It lowers what they then have to pay in their state and federal deductions. That savings funds the program. So you understand me? If they don't do the program, then they're not going to get the savings. And so they're not going to, it comes out basically as a wash, but actually you'll see how Capstone puts even a little more into the employee's paycheck to sweeten the pot, if you will. And again, this plan does not disrupt any major medical supplement or plan that's already going on. It's just an overlay on it, if you would. It just enhances what you currently have, and I'll show you the benefits. Okay, no net cost to the employer, no net cost to employees, and we focus on things before they become a health insurance issue. What's the criteria? 10 or more W-2 full-time employees, 30 hours or more. And again, if you're right on the brink of that 10 or more, you can't count the owners as employees. Okay. So let's go through a couple of the benefits. The biggest one is telehealth. Now that I wasn't really aware of it. That's becoming a major player in healthcare. People love, they'd love to just be able to reach a doctor 24/7, tell them what's going on. They could write prescriptions, even some minor, if it's minor things going on, you go into emergency room, you're having trouble breathing, they might be able to talk you through some things. Again, risk assessment. They'll even do telehealth for things like weight management to help you stop smoking. A lot of different things, depression. They can help you with a lot of that right with telehealth. Okay. So it's an ad. These are added benefits that, again, are not costing the employer or the employee anything. They also have an app that you're going to download that you screen your face, and it can, believe it or not, I don't know to what degree of accuracy, but this technology is out there now where it can give you all these vital signs and health risk indicators to just help you preventative, and the quicker you can find something going on in your body, the much better chance you are of being able to handle it. Okay. And they also work with prescription drugs, over 37 commonly prescription drugs, no cost, no deductibles. They have over 70,000 pharmacies you could work with. And if anything, it lowers your prescription cost quite a bit. Okay. The last piece to this puzzle, let me move this. They have reimbursement, okay, usually about 30 days. So if you do use your medical plan, or if you're out of pocket for hospital visits in or outpatient, they'll provide up to $100 a day, emergency room visit, $150 to $250 reimbursed. And they'll also give you over up to $1,000 a year of money you put out on your co-pays, or 20%, whatever it may be, on preventative screening. Okay, so there's just amazing benefits here. By the way, the company is called Amaze Health that put all this together, working with Capstone. Okay, last thing, and I'm done. Last couple things. This is just a quick glimpse of how the paycheck works. And they do all the work, all the uploading. They work with the payroll department. You guys don't have to do any of this as business owners. Okay. This is just how, in a sense, people say, well, how's it work? Here's the paycheck before and after, same pay, same base pay, same health insurance deduction if you have it, same IRA. Okay. What they do then, they're able to charge a premium for this service, for this wellness plan, which is all allowed. This has already been cleared with the tax codes and everything else, which lowers the taxable income. When you lower the taxable income, you lower these out-of-pocket payments that the employer would be paying to the government. Okay. Based on that, what they do then, Capstone says, wait a minute now, employees don't pay anything. Matter of fact, we want to sweeten the pot a little. They do a claim payment, or they put out of that 1,200, they put money back into the check. And what happens is there comes out the net pay is actually larger after this tax program. So the employee gets all these benefits, plus actually a bigger take-home pay, as you can see. Pretty phenomenal. Remember, the employer is getting a $500 per employee tax, FICA tax per year savings. It's kind of a no-brainer, guys. Okay. Again, just to recap it, preventative health care, $500 savings, $100 more in the employee's paycheck. Everybody's covered on a triple indemnity, and zero net cost to anybody. Okay. All you have to do, business owner or person talking to a business owner, is get them on a 15-minute Zoom or a phone call. The company will go through it. Some of the top reps or the top leaders in the company, not me, not another lower level rep, just right to the horse's mouth. They're going to sit down with the owner over a Zoom, answer any questions, so exactly how this works. If they go forward, they take care of all the onboarding, all the questions, and everything else, as I just mentioned. Okay. If you want to rep this program out, business owners, or a business owner knows other business owners. Okay. There's a $20 a month, we call it PEPM, no license needed, that they will pay the person every single month for every onboard onboarded employee. I told you we have about a 90% onboarding. So if 100 company has 100 employees, probably 90 of those employees are going to be on this program. It's a nice commission, guys. And you, by the way, if you want to split it, that's $20 to go into the person who brought in the business. If someone else leads you to them, you can work out a split. Capstone will, you just say, hey, Capstone, can you give 10 to my brother-in-law who brought me to this car dealership? And then you get 10, they'll do the splits for you. We handle all that. So guys, there's a lot of money to be made. I'm talking to people who could absolutely put me in front of 1,000 employee base, whether it's a union or a school district. Think about that. 1,000 times $20 a month is $20,000 a month of residual income. Don't take this lightly. And it's the easiest money you could make. You just got to bring someone to the table to speak to Capstone. Okay, guys, I'm done. Hope that made sense. Let's rock and roll. It costs you nothing to refer this out. You don't have to pay a fee or anything. So put that in your arsenal of who you know. Do I know any business owners? Or if you're a business owner, absolutely take advantage of the FICA tax. If you have 100 employees, multiply that by $500 a year. Okay, we're done. Hope that made sense. Let's rock and roll. I need a shave. All right.